Dancing on the Waves by Bethel Music, featuring With the Kingdom. It's a song that is bringing us to 7:15. Good morning, and welcome to this third hour of Dawn Break, the breakfast voice of the city with me, Anne Aliviza. It is a Wednesday, a Truth Worship Wednesday, but on this, during this hour, we have a Healthy You segment where we get to discuss matters our health, what is affecting our health, how we can prevent some of the issues that our bodies might be going through. And this month being Breast Cancer Awareness Month, the month of October, we are blessed to have in studio a professional, a specialist who is going to help us with the discussion this morning. We have Dr. Brian Wambua, who is a doctor of oncology, and then also interested in matters human anatomy. Welcome to our studios, Doctor.
Thank you very much, Anne. Thank you. As you said, my name is Dr. Brian Wambua Awero. Yes. I'm a medical officer. I'm happy to be here. Yeah. So today to discuss the leading cancer in Kenya and also globally, which is breast cancer. So breast cancer, in terms of its epidemiology in the world and here in Kenya, it's very interesting. So there are more cases of breast cancer in the West and less cases here in Africa, especially in Kenya, compared to the West. But the deaths due to breast cancer are more here than in the West. And this is due to three main reasons. So one is patient factors, two is healthcare factors, and three is the system factors. So I'd just like to discuss this topic today in terms of those three factors. So in terms of patient factors, the biggest barrier to breast cancer care is lack of knowledge, or the lack of knowledge of early symptoms amongst patients. So you'll find that most of the cases, 99% of the cases of breast cancer will be in women, and 1% will be in males. So the idea of getting to do a breast self-exam every month and being able to pick the symptoms is where now we have a problem. So I would like your listeners to look at an application just from the Google Store app or the Apple Store. It's called Know Your Lemons. For our listeners at home, it's called Know Your Lemons. This application guides you through the 12 commonest symptoms of breast cancer. And so you're going to see within that app, you're going to see a picture of a lemon showing you or helping you to describe what you're feeling. So there are 12 key symptoms. So the first one is usually a lump. So you're going to feel a lump on your breast, and most times it is painless. So the common misconception is that the lumps that you feel in your breast, for it to be cancer, have to be painful. So that's a very common misconception. And so if you feel a painless lump, then you're supposed to go to your nearest healthcare worker and just have it investigated. Now, there are other symptoms that you may be able to pick, even from the application. You can be able to see. You can be able to look at changes on the skin, what we call an orange peel appearance. So just the way the cover of the orange looks like. You can have what you call dimpling of the skin. There could be nipple discharge. Most times, the ones that's more dangerous is the bloody discharge. And so this application, it teaches you how to do the breast self-exam at home. So ideally, you're supposed to stand in front of the mirror. You've undressed, so you just check your breast for what you call symmetry. Make sure that there are no changes in size and shape or any obvious changes on the skin. You could have even maybe a very prominent vein that was not there before. Then you go now lie either on a couch or on the bed, and you put one hand behind your head. So the hand now that is free, you use it to examine the opposite side breast. So that means if you've done this, hand behind your head, and this hand is free, you examine this opposite breast. Okay. And so usually examine in a clockwise manner. So you just feel for any lumps or you feel for any changes that are abnormal. Now, once you've picked a change, if you are below the age of 35, you should go in for what you call a breast ultrasound. So a breast ultrasound is basically a machine that usually uses what you call sound waves. It's very non-invasive. What we mean is that it's not a painful procedure and it doesn't use x-rays. Okay, so it just uses sound waves. And this is more for the younger women, so below the age of 35. And for the ones above the age of 35, we recommend what you call a mammogram, which is now an x-ray. So we tend now to be able to see whatever changes you've noticed. We can now be able to characterize it better and see it better on the image. So being a breast cancer awareness month, a lot of facilities are subsidizing most of these costs. So your nearest healthcare provider, if you go during this month, you'll be able to actually get it at a lower cost than the way they usually charge. Yes. So you'll find that for a lot of our patients, the reason why that data differs from the one in the West, where they have more cases but less deaths. Here we have less cases but more deaths, is because they are able to detect early. So they were able to do campaigns in the West early enough. And this was actually because of the celebrities in the West. So maybe one of the few celebrities I can mention was Beyonce. Both her parents, her mom and her dad, actually got breast cancer. And because of that, they became very vocal advocates. There's another singer by the name Taylor Swift. Also her mother was diagnosed with breast cancer. And interestingly enough, it was after Taylor Swift and her brother pushed the mom to go for the screening. She had actually never gone for screening. But the first time she went for screening, that was when it was picked. So you'll find that because we don't have a lot of these advocacies and programs like this, like the show we're having now, where we're able to tell women every month, examine your breast. Every month, examine your breast. Every year, make sure after the age of 35, make sure you go for an annual checkup. So if you're able to do that, we'll be able to catch this early. Now, what's the benefit of early detection? So once you're able to pick any of those 12 symptoms and you've gone for the mammogram or the breast ultrasound, then it makes it much easier to contain the spread of the cancer. So you're going to get it at a very early stage. So the early stages means that the cancer is just within the breast. It has not gone outside the breast. And that's very important because it means then you may not have to lose the entire breast. And so you'll find that a lot of women will fear getting this cancer diagnosis because they'll be afraid that they're going to lose their breast. But if you catch it early, it means that you are able to contain the cancer, remove it. You may have to do maybe some bit of what you call breast conservation surgery. What we mean is you'll basically just reduce the size of the breast but not lose the entire breast. Now, if you get it at a later stage, at a very advanced stage, the problem is it may have spread now to other areas, for example, the brain. Okay? And so once it gets there, now the chances of having a poor outcome increases. And so to our listeners out there, doing a breast self-exam every month is very key. If you're above the age of 35, going for annual mammography is very important. Just having an annual checkup for the breast, very important. And this will help you. If you're able to get it early, the chances of survival increase. So,
Bwana Daktari, I hear that it also affects men.
Yes.
And I think that is something that you can demystify, because we believe that when matters breast cancer are discussed, the women are the ones who are mostly affected, and that is it's a female issue. It does not concern us. Talk to the men out here.
All right. Thank you, Anne. Yes. So, yes. So you hear that 1% of males get affected. And I know when you talk about statistics or numbers,
yes,
people usually say, oh, you know, what is 1%? But you see, 1% is significant if it happens to you or your loved one. It becomes significant. And so as I was telling you that one of the popular celebrities in the US, Beyonce's dad, he's called Matthew Knowles. What he did was he just discovered a bloody nipple discharge. That's how he discovered it and went in for an exam. Prior to that, he had not really been checking his weight, his lifestyle. And so a lot of men out there, when it comes to physical exercise, at a certain point, let's say the middle age, there is a lot of pressures. And so people say, I don't have time to go to the gym, I don't have time to eat right, or take my fruits or eat my vegetables. So you'll find that because of the changing patterns in terms of lifestyle, how we are eating, lack of exercise, then we are going to see a shift in these statistics very soon. Yes. And 1% is a significant statistic if it happens to someone you love or someone you know. Yes. So I would actually encourage the same self-breast exam techniques. They are the same for men and women. The same management for breast cancer, same for men and women. So I would encourage more men out there also do this self-breast exam. Stand in front of the mirror in the morning, check your breast, see if there's any change in the size. Just lie on the couch, feel for that breast, see if there's any lumps, any changes. Yes.
Hey, will the men really do that? They're wondering. Doctor is saying that we stand before the mirror and then we just pass by the mirror as we go. But thank you so much for that, Brother Daktari. If you don't mind, you can now delve deeper into the symptoms so that we know what are these symptoms. Because sometimes I have a lump here or just a boil that is coming up, and then I start freaking out and think that I have breast cancer. So talk more about these symptoms.
Very good. So I'm actually just going to follow the Know Your Lemons app so that for the listeners out there who've been able to download the app, you'll be able to see the 12 symptoms. Okay. So the first one is a hard lump. And if you look at the hard lump in that application, you're shown a picture of a lemon that has been cut, and you can see a picture of a seed. So that is the consistency that you're going to feel. So it's a hard lump that looks like a seed. Okay? So if you felt a seed before, I'm sure most of us have felt, that's the consistency that you're going to feel. Okay? Then the second one is a thickening area of the breast. So there's just an area of the breast that feels ni kama imefura kidogo kushinda the rest. Okay? So a lot of people usually dismiss that, and usually a lot of the patients who will later come to hospital or be referred will tell you that they went to a healthcare facility and they were told it was just fatty tissue of the breast. Wanaambiwa hiyo ni mafuta tu. But if you do, the reason why I keep insisting on monthly self-exam of the breast is so that you know you are normal. So that if you feel that thickening, you know that this is not normal fatty tissue. We all know sometimes we all gain a bit of weight here and there, but you know how it feels like. Even if you've gained some weight, if you're doing monthly breast exams on yourself, you will know the change. You'll know that this is not normal thickening. Okay. And so even when you go to the healthcare facility, you'll tell them, this is not normal for me. This is not normal. Okay. So the next one is a breast dimple. Okay. And if you're able to access that application and see that picture, you'll see it looks that like skin has gone ndani, imeingia ndani. Okay. So it has gone a bit in. And so this is not normal. Okay. So if you see there's an area of your breast inakaa ngozi imeingia na ndani, that should worry you. Okay. And you should actually see a healthcare practitioner as soon as possible. Then you have what you call a nipple crust. Okay. So the nipple crust is, I want you to imagine when you've woken up in the morning and your eyes are shut together. Okay, if you've had a very deep sleep. Okay, just before you wash your eyes. So that crust around your eyes, if you have such a crust around the nipple, that should also worry you.
And you're not breastfeeding.
Yes. And so this is just to differentiate between what you call nipple cracking. So the nipple cracking will be a bit different. You know, this one now is you're having so in breast cancer you're going to have a nipple discharge, and then you're going to get this crusting. In the normal breastfeeding woman, the cracks are usually because of the suckling of the newborn, and so that will be will be a bit different. Good. And then the other one is now itchiness around the breast at one spot. So you'll find that there's an area of the breast, that's just one area that is very, very itchy. Okay. That should also worry you. If you find new fluid, especially bloody discharge, okay, so inatoka kama damu, that should actually concern you. And then the other one is skin sores. Skin sores is where you have like a wound. Okay, so unapata kidonda kwa matiti, so like a wound around the breast. So that should actually worry you. And so sometimes when you get these skin sores, it usually tells us that it could be a bit maybe more advanced. You may need more investigations, but it tends to mark a more advanced disease. Then you can have what you call a bump. So a bump ni basically kufura. So you just see something has popped, okay, in one area of the breast. Then you can have what you call a growing vein. Okay, so this one now is where mishipa ya damu, it looks more prominent. So you're going to notice this when you're looking in the mirror. Okay, so you're going to see that because you're used to checking every month, then you'll note that one side of the breast, one area, the vein looks a bit prominent, it looks more pronounced.
But Daktari, before you proceed,
no problem,
the growing vein, we normally see it, especially when you're lactating. We see a vein. So how can you differentiate the one that is a symptom of breast cancer and the other one for lactating mothers? And now this is so this is where we are calling it growing. You see, the normal one, when you're breastfeeding, you are going to just see a normal collection of veins. So you're going to see a branching pattern. It looks like the way like rivers, you know, the way the river looks like, with tributaries and all that. So it just looks a very nice normal pattern, and it doesn't keep changing and growing. So if you see a vein, okay, that is becoming, it's growing, it's becoming more and more prominent. Okay, so it's either increasing in length, it's increasing in width. Okay, so every time it just doesn't look normal like the rest of the veins that you are seeing. So it's becoming more and more prominent. So the difference is the progression. So in the normal breastfeeding, you're going to see just a normal collection of veins. That's normal. But if it becomes prominent and growing, so the progression is what you are checking for. And again, that's why we are saying every month, so that you note the progression. Okay. Go ahead. Give us more of the symptoms. The other symptom now is what you call a sunken nipple. So a sunken nipple is, so the nipple has gone inwards. Okay. So a sunken nipple tells you that you need to actually go to the nearest healthcare facility to have it checked. So this is not one of the symptoms where you'll say, when I get time off work next month, I'll go
if I'm on leave in the next 3 months, I'm going to go.
Yeah.
So the minute you see the sunken nipple, please just make sure you visit the nearest healthcare facility. Yes. And the next symptom now is a new shape or size. Okay. So if you look at that picture on the application, you are seeing this lemon looks deformed. It doesn't look normal, the normal rounded lemon. Okay. And so this is very key. If you look at your breast every month, and then you notice a distortion in the shape, and that's where now the symmetry comes in. Your right and left breast, you've been checking them every month. Then you notice one breast now looks like it has a bit of bends or something. So that now should worry you. It could be the only symptom, but it should worry you. Yes. Then the next symptom now is what I was calling the orange peel. Okay. What in the medical profession people call peau d'orange. It just tells you orange peel, like this orange here. So this so it usually looks like dimpling.
It
of
has
the skin.
pores.
More
open pores.
Yes. So when you look at it, it's like there's this dimpling of the skin around a given area.
So not the entire breast.
So a very specific area. So that if you look at that, the reason why I want people to have this application, I've not been paid by the makers of the application. This is free advertisement for them. But that picture helps you to actually see that difference. Yes, that orange peel. And so those are the 12 key symptoms. And as you've noticed, as we've run through all the symptoms, we've not really belabored on pain. Okay? Because that's usually the biggest misconception that we have in this country, that I felt something, I saw a change, but there was no pain. So I didn't feel like going to hospital. Because rightfully enough, a lot of people believe if they have a symptom and pain is one of the symptoms, they should go. And they believe that if there is no pain, then it's not a big problem. And that is usually one of the signs of breast cancer is that it's going to be painless most of the time. And that's one of the things I wanted to emphasize on.
So Dr. you're saying that we need to go for screening, whether you are feeling pain, as long as you have this dimpling, as long as you have sores, and sometimes itchiness, you said.
At a specific area.
Not the entire breast.
A very specific area and that is constantly itching.
Just before we go for a short break, I would like to know how, because you've mentioned about people above the age of 35 and above, they should take the screening regularly and serious. But what age has ever been reported that maybe younger generation? How young was a person who was affected with breast cancer?
Very good. That's a good question. So in terms of age limits, you can have breast cancer even below 20 years of age, but it's very rare. So we usually say that pediatric breast cancer. So this is breast cancer in patients below the age of 18. They are very, very rare, less actually than 1%. But the problem is when you get breast cancer in the pediatric population, it tends to be very aggressive. And that's now the disadvantage. If by the time you're picking a pediatric breast cancer, it's going to be a very aggressive tumor. Most of them, you are not going to get what you call early tumors, like in adults. So if you get, let's say, a 40-year-old with breast cancer, you might get them in what we call stage 1, when it's not very advanced. But if you get, let's say, a 16-year-old, you're going to get a very malignant cancer. So that's the main difference in terms of pediatric versus adult population. And just to clarify, most of the listeners, if you go and Google and you read, you're going to see that most recommendation is to screen after the age of 40. That's the commonest recommendation. But this is because we are using Western data. Our local experience is 35. We actually not picking it early.
Yeah.
Yes. So in as much as 40 is what, when you go and read your Google, you're going to see 40, 40, 40. But in our local data, 35 is the cutoff. Yes.
Thank you so much for that, Daktari. My listener, you can send in your question. The doctor is here. Dr. Brian Omboa is here with us up to 8. The number is 0727907907. You can send a text message and I'll be able to read it so that he can help us as he's having his time here. By now, I know you've done your self-examination. I know it's cold, but you can just go to the mirror and do all the screening and the process that he shared with us. By now, I think there is something that is ringing in your mind. So don't go away. We'll be coming back after this short break.
He still loves me.
Jonathan, Mark Reynolds and Jamal Roberts with the song Still. It's bringing us to about 13 minutes to 8 a.m. Good morning and welcome back to this hour of Dawn Break, the breakfast voice of the city. My name is Anna Liviza and this is 90.7 Truth FM, Truth Worth Finding. It is the Healthy You segment and we have Dr. Brian Wamboa in studio here with us, and we are looking at a very important topic. October being the breast cancer awareness month, we had to have this discussion. And we are discussing the causes, the risk factors of breast cancer and how you can achieve or receive treatment. Karibu tena Bwana Daktari.
Thank you so much, Anne.
Yes. There is a question here.
Yes.
Before you continue with the discussion, someone is asking, hello, Truth FM, I have a question for Daktari. Women who have inverted nipples, are they prone to have breast cancer? You answer this, listener, before we get going.
All right. Thank you so much for that question.
Yes.
So there are women who are born with inverted nipples, and we call it congenital inverted nipple. So what is an inverted nipple? An inverted nipple is a nipple that has sunk in. So if it's present at birth, if that's how you were born, then that's not a problem. What we are discussing is a woman who's grown all the way, she's an adult now, has always had a normal nipple, and then it becomes inverted or sinks in. That's now the risk. That's one of the symptoms to now go checked out. But if it was present at birth, then that's not really a problem. Yes.
Okay. Thank you. I hope you've been helped, you've been assisted by that answer from the doctor. And now, Dr. I would want us to know, someone might be out there and asking, you're talking about breast cancer, but what causes it? And what are some of the things that predisposes me to getting the cancer? More or less the risk factors.
All right.
Yes,
thank you, Anne. So most of the time in terms of cancer, we actually don't know the main causes. We don't know how or how the cancers come about, but what we have are risk factors. And so we look at risk factors in two ways. There is what we call modifiable, things that you can change, and non-modifiable, the things that you cannot change. So modifiable risk factors include things like lifestyle factors. So this is diet and exercise. Those are the biggest factors. So you're going to find that if you read about any cancer, not only breast cancer, you're going to find that smoking, alcohol, living a sedentary lifestyle, just obesity by itself is a very big predictor. So if you are able now to start being more active, eating less red meat, taking less alcohol, stopping smoking, then you're able to modify your risk of getting breast cancer. Then if you have the non-modifiable, then there is nothing you can do about. So these are things like genetics. So without going too technical, there are certain genetic tests that are usually done. About 15% of women who have had breast cancer have what you call a BRCA gene, BRCA. So BRCA gene, there are two types. There is 1 and 2. And they run within families. So you are going to find that within a certain family, they've had this case where the aunt had breast cancer, the niece had breast cancer, one of the cousins had breast cancer, And this is because now the BRCA gene is there within the family. Yes. So that is non-modifiable. There's nothing you can do about that. So the non-modifiable risk factors, the main reason to have it screened is if there is family history. So if in your family there is history of breast cancer, then it might be important now for you to actually get the genetic tests done. Yes.
Thank you so much for that.
Yes.
And probably at the end you'll be giving hope to someone who has just been screened and found that they have cancer. But talk about screening.
Yes.
Why are we so afraid of screening? Just the other day we had a conversation with the listeners, and they were really saying that, no, I don't want to go and look for something that it has not been there. Now I go for screening and I get it. Tell us the importance of screening and why we should be doing it.
Yes. So you've mentioned one of the biggest barriers for patients is that fear of finding out now they have breast cancer.
Yes.
And this has become a challenge, especially in terms of early detection, because the biggest benefit is detecting early. You detect early, you are able to treat and improve survival.
Yes.
So if you are able to get it early, and this is the advantage of screening, then we are able to treat it early and contain the spread. So the biggest fear that we've seen in terms of the research that has been done in the country is a lot of times you'll hear patients saying, I don't want to lose my breast. That's one of the biggest fears. And so one of the things that is being done currently is we are getting more and more specialists in breast cancer who are doing what we call breast conserving surgery. So if you detect it early, there are things that you can be able to do that will preserve the breast so that you don't have to lose the entire breast. So that you can just have where the cancer is, you just have that area removed, and then you can preserve the rest of the breast. Now, if it comes to a point then the breast has to be removed, then you can have what we call implants. Okay?
Yes.
And these implants will give you the appearance of just having normal breast. Because most of the time the biggest fear is actually not even losing the breast, is how you'll appear to people, and what we call aesthetics. So will you, when people see you, they'll see this change in your chest. And so if people can be able to know that yes, you can have the breast conserved and not lose the entire breast, and if it has to be removed, then you can have an implant to give you back that shape of the breast. And so the lack of knowledge or lack of know-how to get the access to this specialized care is, I think, one of the biggest hurdles that we are having. So if you can have more of such shows where people now can be able to spread this information, you get more experts here who can be able to talk about this, then I think that fear will go away. Yes.
Thank you so much.
Yes.
That fear really affects most of us, and we are afraid of screening. And whenever we pass by somewhere and there's a tent for breast cancer screening and also cervical cancer, we are afraid. We say, sitaki kutafuta chenye hakuna. You see? And you've talked about surgery. Is that part of treatment? And,
yes.
And is it final? Like when they have undergone, maybe the doctors have examined me and they have said this is the best treatment for you. Does someone heal?
Yes.
That is the question that you'd really want you to answer.
No problem. That's a good question. So it is actually very interesting because we've not really demystified to the public what surgery in breast cancer actually means. Let me give you an example. So one of the ways we investigate for breast cancer is to check for if it has spread to your armpit. Okay. So it's something called a sentinel node biopsy, lymph node biopsy. And so a lot of confusion comes in because this is an investigation. We're just checking if it has spread to your armpits. So a lot of patients, because there's something is being cut and removed, they assume that the surgeon has done the surgery and has cut it out. And so they go away thinking, me, I've had the surgery. So they become lost to follow up. So we don't actually get to see them again. Because now they disappear and say, me, I had the surgery. But it was an investigation to check if it has spread. So to answer your question, there are 3 ways that we usually treat breast cancer. So there is surgery. There is drugs, what you call chemotherapy, and there's also radiation. So those are the 3 ways of treating. And depending on how advanced the disease is, you may actually require all 3 in a different sequence. So let's, for example, say you have a very huge tumor. Okay, the cancer is very big on the breast. Before the surgeon can operate, he might decide to give you drugs to reduce the size of the tumor. Okay, and so that he can now go in and find a tumor that he can operate nicely. Then sometimes after removing a tumor, they might find that they were not confident that they've removed everything, so they'll send you now for radiotherapy to kill whatever is remaining, or just give you drugs to kill whatever is remaining. So these 3 should be expected if you are going through this journey: radiotherapy, chemotherapy, and surgery. And always ask your surgeon, whatever you are doing, is it final? Because you've asked that question. And that's a very key question, because it makes a lot of patients become lost to follow up. Because when we operate, so you find that the patient has been operated, they disappear not knowing that they need to come back for radiotherapy. They believe that it's gone completely. So I think to answer your question, that's how I'd put it.
And that's fine. That's enough for today. But before you leave, I'll allow you to give your contact. But before you do that, talk hope to someone, that person who has gone for screening and has been diagnosed with maybe breast cancer, stage 1. That is the earliest stage. Yes. Tell this person something.
All right. So to our listeners out there, I want to insist that breast cancer is not a death sentence. So that's very key, that it is not a death sentence. Early detection means that we have a good chance of getting the whole cancer out. So if you've been detected to have this tumor, then please make sure that at the earliest convenience, make sure that you have follow-up with your surgeon and have the tumor removed, go to see what we call the oncologist to have the chemotherapy and now the radiotherapy. So make sure that you follow up in terms of the care. And just to mention something, Anne, before I leave, there are what we call breast cancer support groups to your listeners out there. The Aga Khan Hospital on May this year, they actually launched the Aga Khan breast cancer support. So if you go online, you're going to see that they have a hotline where you can actually just call and register. And within this support group, you're going to get a lot of people who are also within this journey. And that becomes very important, because now it's no longer a specialist talking to you, it's someone who's going through whatever you're going through. And that becomes very key in the journey, because these people, they help each other in terms of, if you're having, let's say, problems with the nausea from the chemotherapy, they can tell you what they did, which drugs they found most helpful. And just having that talk gives you hope. So I will tell them to reach out to breast cancer support groups. Thank you.
And finally, I know you'll be coming back some more to shed light on some of the issues that we are going through health-wise. Give us your contact. A listener might be wanting to talk to you directly or to meet you. If you do not mind, you can share where you work and all that.
No problem. So my number is 0728 325 042. So we can reach out and then we can talk further. Thank you very much.
You can repeat your number as we finalize it.
All right, so my number is 0728 325 042. Thank you so much.
Thank you so much, Dr. Brian.
Thank you.
It's a pleasure having you. And we'll be having you more.
Thank you.
That is it for now from our Healthy You segment right here on Don't Break. We'll be having these conversations in the entire month of October. We are creating awareness on breast cancer. Go get screened and get your health in check. News point up next, and then in the next hour I'll be here with Pastor Sophia. Don't go away.
The